for the call. From OPQC, Dr. Jay Imes is on our call with us to help answer any questions about any clinical content or progesterone questions. He's the OB clinical lead for OPQC. My name's Kathy Jaworski, and I'll be facilitating the call. And Mary Bauer and Andrea Hoberman are other quality improvement consultants who are on the call to help manage the chat box and help answer questions that might arise. We also have the privilege of having Sean O'Hanlon from Duet Health on the call to talk about the data, and Alicia Brown, a quality improvement manager from the Ohio Department of Medicaid, who is going to discuss issues about the PRAF 2.0 and answer any questions that might have arisen in the last few weeks since our last call. Next slide. The agenda was put together based on questions that we've received from you over the last 3 to 4 weeks, as well as things that you highlighted in the registration list of things that you wanted to learn more about. So to begin with, after the introductions, Alicia will talk about accessing the PRAF 2.0, and then I'll share some information about the managed care plan coordination. Sean will go over practice level data, and then we'll finalize with some frequently asked questions and questions from the people on the call today. Next. I wanted to clarify on our last call on November 8th, we talked about the 3 forms of the PRAF. We talked about the old ODM form that had been discontinued in November of 2016. And I had stated that that was the ODM form 53535, but it really is the ODM form 03535. And I wanted to make sure to clarify that for you in case that was the form you were using. Thank you. Next slide. Next, we're going to ask you to start out with a polling question so we can get a feel for how things are at the present time for you. And I would really like for practices who are providing medical care for obstetric patients to answer these questions. And the first one is, are you currently using the PRAF 2.0? Yes or no? In the last 4 weeks, have you been able to start using the PRAF 2.0 or even before that?
Just a second, Kathy, we're pulling it up now.
Thank you.
All right, Kathy, it looks like the polls are in progress.
Okay, great.
No one has answered yet.
Okay. Is anyone having any trouble with these polls? I know I can't see them. Can others see them?
Kathy, this is Mike Marcotte. I can see the poll, but it requires you to answer both questions, and question 2 may not have any problems with the PRAF, so you can't submit it unless you answer both questions.
Okay, I apologize for that. So,
Kathy, this is Andrea. There is a button at the bottom of your screen that you may have to click on that says polls. So it's next to the participant icon. It looks like a little graph. So just so everyone knows, because I could not see them either, and then I realized I had to click on that. So if you aren't seeing them at the bottom of your screen, there should be an icon that says polls.
Interestingly, mine, and I'm wondering if others are experiencing this, mine says that I'm logged in from another device and my polling session is inactive. We may have to skip this today.
Yeah. Kathy, we can encourage everyone to answer in the chat box. We did have 4 people answer, and then people are responding with the icons, yes and no. So if they want to answer in the chat box, that might work.
Great, good idea. Why don't we go ahead with that? Answer yes or no, and then if you would want to just write in any challenges that you're experiencing, you can. The choices we gave you were finding a MITS administrator or logging into the MITS, creating your practice profile in the Nurture Ohio system, submitting your PRAF, or feel free to put in whatever you want. We'll give you a minute or so that you can do that in the chat box. Let's go ahead and move on, and you can continue to answer those questions, and we'll review that as we go along and try to answer questions that have come up, or we'll review it at the end of the call too and may reach out to you. Now, this is just the same housekeeping slide that Brianna went through, but I wanted to go over it again just in case you came on late for the call. If you are on the computer and then on a phone line, if you go to the join audio at the bottom and you take your participant ID, press pound, participant ID number, in this case it says 49, and then pound again, it will bring you in. It'll show you then in the participant list, and it'll show your name. So we'll be able to see who's on the call with us. Next screen. In the registration, we asked you what kind of questions you were having regarding the PRAF. The number one response was you wanted to get information about getting access to the MITS and the Nurture Ohio system. Then next was getting data from the Nurture Ohio system. And then the lower number was coordination of care with Medicaid and managed care plans. Those are the topics that we're going to focus on today. Based on your need. But if you have any other questions, please don't hesitate to put them in the chat box or to just call out if you are able to. If you would like to speak and are on mute, ask in the chat box if you can please have verbal speaking ability, and we'll enter you. Next. As I mentioned, Alicia Brown from the Ohio Department of Medicaid is here today, and she's going to review what she talked about in our last call about how you get access to the PRAF 2.0 and answer any questions that you have. Alicia?
Good afternoon. Can everyone hear me okay?
Yes, you can.
Okay, wonderful. First, I just want to thank everyone for joining the webinar today. I know this is very important work, and I really appreciate everyone taking time out of your schedules to join us. So getting access to the Nurture Ohio system is something that we're aware that practices need to understand what steps they need to take to access it. And there really are 3 simple steps in accessing the Nurture Ohio system. And thank you, yes, next slide. The most important step is first to identify who will be submitting the PRAFs within your practice. Some practices have people who are front office staff, so office managers, or some people have nurses submitting them. So I think it's important to identify who's submitting them, because those individuals who are submitting the PRAF 2.0 need to have their MITS ID. They need to be a MITS user. The second process is, once that person has set up a MITS account, is that they need to identify who the MITS administrator is so that they can assign them what we call a prenatal visit agent role. And that prenatal visit agent role gives you access to the Nurture Ohio system. And so the MITS administrator is typically someone within your practice, if it's a smaller practice, who is within your front office or does your billing. And sometimes in a larger health system, it might not be someone you know. So it can be a challenge to find that person, but we're definitely here to help assist you get that. And then the last step, of course, is then just logging in with your MITS credentials that you identified in step 1 to access the Nurture Ohio system. And we'll go through these steps a little bit more in the next slide. So step 2. Next slide, please. So as I mentioned, just definitely identifying who the person is that's going to submit the PRAFs for your practice. And this is a simple process that usually takes about 30 minutes once you log in and set up your username and your password. You do have to wait 30 minutes, but you go to the MITS portal and you just follow this link that's there, and you simply log on, or excuse me, click the link that's there to become a MITS user, and you follow the steps. You will need to know your practice level information, so your national provider ID as well as your tax ID, so that we can link you to the appropriate practice. The next step is, again, of identifying that MITS administrator. So some practices, and I've even assisted with identifying who the MITS administrator is, but it's typically just asking those questions. Who in our practice knows who does our billing? Can you go to the front office staff and ask if they know who submits billing for them? That's kind of the first step to identify who that is, so that they can assign you the role. Our request is that once you have identified who your MITS administrator is, that you send them an email, and it has your MITS ID that you have self-identified through the first step, and that you need to be linked as a prenatal visit agent within the MITS system. And so that way they know who they're linking it to, what your ID is, and it would make it easier for them to follow the steps that are identified for them to assign you in the role, which is step 2.B. And so this link as well provides the process that the MITS administrator will need to follow so that they can grant you that prenatal visit agent role. If you are still having challenges in identifying who your MITS administrator is, there is an 800 number that you can contact with the identifying information, which is your national provider identification number, your tax ID, and your practice location address. These 3 pieces of information are very important because it helps us as Medicaid identify your specific practice that we need to associate you with. And if you are still having challenges, there is some additional information that we can provide to help you assist with getting the information that you need. So the third step then is, once you have the person that's going to be submitting the information, they've set up their MITS ID, you have contacted your MITS administrator, and you have the prenatal visit agent role assigned. The third step then is that you would simply go to the Nurture Ohio system, and you would use your MITS login credentials. So the user ID and the password that you developed within step 1, and you log into the Nurture Ohio system using the MITS dropdown. And I don't think we have a screenshot here, but it would allow you to, there are 2 options. There's a MITS option, and then there's also an internal option. As a practice level provider office, you would select that MITS option and use those login credentials. Next slide. And here are some additional links for you to follow, and to get some additional instructions on how to assist with getting your MITS user ID, your MITS administrator to give you the proper prenatal visit agent role so that you can access the Nurture Ohio system. And you have to have both. So even if you log in, if you get your MITS user ID, you must still have that second step. You must have your MITS administrator assigned you that prenatal visit agent role. If they do not, then our system, Nurture Ohio, does not know that you have access and the proper credentials to view and submit information for your patient. And here is our contact information. This comes directly to Medicaid. If you are having issues with identifying who your MITS administrator is, you're having login issues associated with either invalid username, invalid password, feel free to email the progesterone PIP at medicaid.ohio.gov email box, and someone will get back to you as soon as they can to help assist you with those login issues. Next slide.
Thanks, Alicia.
You're welcome.
Do you want to go back to that previous slide, please? If you have any questions, write in the chat box. I would also like to, I see that Carla Welsh mentioned in the chat box that she was able to get on the PRAF. Could we open Carla's line? And Carla, would you mind sharing with us how the experience went for you to get the PRAF access?
Hi, this is Carla.
Hi, Carla. Thank you.
Hello.
Sorry for putting you on the spot.
That's okay. I actually gave it to one of the MAs that works with my she's like my OB queen bee here. So we have a book that we try to follow everybody, and she's been doing all the forms, the different forms, and so she got online, and even I have done a couple. It's very easy. I think easy friendly. You just have to have the information that's on the form because that's what you need to put into the computer. But I thought it was very easy and very friendly user.
Oh, great. Good to hear.
Does that make sense?
Yes, yeah, very much. Thank you for sharing that.
Yeah, because she did probably about, I think she said she did 15 or 16 the other day.
Okay, great. And what practice is that, Carla?
This is Mercy Mommy Bay OB-GYN.
Okay, great. Thank you very much.
Mm-hmm.
For anyone who answered in the registration that they had questions about it, do you want to answer? Did we answer the questions, or would you like to write it in the chat box or raise your hand and we'll unmute you?
Yes, if you have any questions, I'm more than happy to assist you and answer any questions that I can.
We'll go ahead and move on, but as your questions come up, just put them in the chat box. Don't wait to see if you have an opportunity to ask them. Excuse me. So I'm going to review how to coordinate care with Medicaid through the PRAF from the office side. Excuse me, I'm just going to take a drink. In the pregnancy risk assessment form, the page will look like this, and it says provider contact. And the first question is, I'd like my patient's managed care plan or home health or pharmacy to communicate with my office regarding any urgent needs identified below. From there are drop downs that ask what the need is and how to get in touch with you. Go to the next screen. This next screen shows it just a little bit larger. The question of, I'd like my patient's managed care plan to call me to help me with a patient. And the next screen, this shows what is available. We have a drop down, but there's also an area that says other if the drop down doesn't fit your patient's needs. So those could be needs with anything from alcohol, tobacco, opioid issues, transportation, mental health, anxiety, bipolar, depression, any needs. Now, if you choose other needs, another box will drop down and you can write in what the other need is. Next screen. One of the managed care plans agreed to be on the call today just to share what is behind the scenes, what happens to the PRAF when it gets to a managed care plan. Now, again, this is one of the managed care plans. The other managed care plans who are on the call may want to share their story after Angela is done. And this is Angelina Clark. She's a registered nurse from Paramount, and she's an Paramount Advantage case manager. Angelina, can you speak now?
Yes, thank you. Does everyone hear me okay?
Yes, I can hear you well.
Okay, thank you. Thank you for this opportunity. So I'm just going to kind of briefly go over here at Paramount, kind of behind the scenes, so you kind of get a quick shot of how we handle the PRAFs when we do receive them. So just a little background, we receive roughly 40 PRAFs a week at Paramount, and about 25 of those are through the electronic system, and then the other 15 are what we call paper or through fax, snail mail, email, those types of things. So basically what happens is once we receive the PRAF, we have a designated person or individuals who will review the member's needs. They'll look on the provider's input on the form. We also kind of reconcile that with the claims that we've received for this member. And then we also look at their geographic or their zip code area, because we obviously are tracking some of the high-risk zip codes in the state. So if we identify them as high risk or have identified needs, then a case management referral is then placed for the member. And that referral goes to a designated OB case manager in their location. So we have OB case managers throughout the state. So that way our members are working with someone who are in our regional offices and, you know, in their communities. So and based on the numbers, so out of our PRAFs received, roughly 25 out of the 40 result in a case management referral each week. So once the referral is received, the case manager will then kind of review the PRAF, any documents attached to the member's claims, and then identify any further needs they may see, and then outreach the member for case management or coordination of care, for example, for a progesterone individual. If no case management or high-risk needs are identified, then we do tend to try to place our members in disease management, where it's a little less contact with the member, but yet it's still providing that accountability and education throughout their pregnancy and postpartum to make sure that they're getting the care, follow-up appointments, and those types of things. So that's kind of what happens when we first get the PRAF. So how do case managers, how do we use the information, and how does it to help our members? So once again, it identifies needs at the time of pregnancy notification. Obviously, hopefully that's sooner than later. It can provide early intervention for their needs, especially things that are time sensitive. So progesterone injections, opiate treatment and rehab. We have updated contact information. Many of our members are more likely to keep their providers abridged to their address and phone numbers rather than Paramount or the county JFS. So sometimes numbers and addresses we have on file are, you know, ones that are 2 times old. So it's helpful to have that updated information. It also is helpful because the identification of needs, when we're outreaching these members, the members may not necessarily tell us some things. Sometimes it's fear of judgment. So if they do have a drug or alcohol problem, if there are custody issues with some of their other children or going forward with this baby once it's born, you know, lack of knowledge of the importance of providing some type of information. So something that may seem like a routine diagnosis of, say, asthma to one of our members, that's really important for us case managers to know, so that way we can facilitate the coordination, education, those types of things for those members. You know, that way the PRAF can help us kind of identify some of those needs that the member might not actually provide for us. It will allow us to ask those trigger questions. So how is a PRAF 2.0 helped me help patients quicker than the written form? So this is especially helpful for progesterone candidates. So all of the providers, so your pharmacy, home health agency, the managed care plans, everyone's notified at the same time. There also is a less risk of error in faxing or email. So going to the wrong number, the wrong person's email, not being transmitted correctly. It's easier to read. It's more concise. There's no issues with the clarity or the legibility of someone's handwritten form. And then usually it also, one of the other things is it's the most up-to-date form. So sometimes we will get PRAFs that, you know, are a little bit older. We try to follow back up with that office to make sure they have the most updated one. But those are just some of the reasons why it's helpful to have the electronic PRAF 2.0. And then I was asked to kind of give an example of information I received from a PRAF that's been sent to me and how it's kind of helped me as my role as a case manager. So I was kind of thinking back, and recently I had a member who was a progesterone candidate, but the provider also stated that she needed behavioral health linkage and she had some needs. So I outreached the member, and during her assessment, she never fully expressed her behavioral health needs. She did mention she had a history, but she didn't go into full detail. So I was able to discuss that a little bit further with her, and she opened up more about her immediate needs. So had I not known that she had those behavioral health needs or linkage needs, I maybe wouldn't have asked some of the questions I did. I maybe wouldn't have, you know, kind of pulled a little bit more information from her. And because of that, the behavioral health needs she was having was interfering with her clear ability to coordinate her progesterone injection. So she had like increased anxiety, she was overwhelmed, those types of things. So I worked with her to get the progesterone set up, you know, made kind of those middleman phone calls to get coordination with, you know, home health and pharmacy for delivery and that type of thing. But then also worked with her in getting into a behavioral health provider and getting treatment and a plan going. So once she was started on her progesterone, got linked with the behavioral health, she actually said to me, she goes, I would not have been able to do all that on my own. And she goes, you know, it's really helpful. So that's an example of how the information from a PRAF can definitely help coordinate a member or patient's care. So there's countless members who have had the same kind of situation where their needs are identified on the PRAF, and, you know, or it may be a social determinant, so homelessness, food, need to help with linking to WIC or food stamps, so safe sleep needs, custody issues. So all of that information that is as thorough as it can be really helpful, because us managed care plan case managers who work with these ladies, we also are, you know, kind of in the community with them. We have a lot of resources that we can use. So that's just kind of a overall how it kind of works with the PRAF here at Paramount. And if you have any questions, you can always, you know, contact myself or our director or whoever. But thank you for the opportunity to kind of go over that, and yeah, have a great day.
Thank you very much, Angelina. That was a very nice summary of how the PRAF is used, and a great success story. Thank you very much for sharing that.
Thank you. Thank you so much.
Go ahead on to the next slide. Sean O'Hanlon is here from Duet Health, and he's going to let you see how you can get into the PRAF system and see the data from your practice. Hi, Sean.
Hey, how's everybody doing?
Very good, thank you.
Perfect. Let me just try to get my screen shared, and then we can.
Sean is going to do this as a live presentation, and so as we prepare to to switch the presenter screen, if anyone wants to ask Angelina any questions, or if there are any other managed care plans who want to share a brief story of how they use the PRAF 2.0 to let the offices know. And if you have trouble with a mute, just let us know in the chat box. Please unmute me.
Perfect. Is everybody are you able to see my screen, Kathy?
Yes, I am.
Perfect.
All
Great.
right.
So as Kathy mentioned, I'm just going to take a few minutes here and share what we have in the what we call like sort of analytics or intelligence center within the progesterone site. So I'm logged into a practice login here. I'm not going to go back to the main screen or anything just to avoid showing any forms or anything that are in process. But just wanted to show that once you're logged into your account, as soon as you have at least a single form entered and single PRAF entered, you will have the analytics section and you'll be able to view that data in there. So this is the first page you'll come to. You can see that it defaults to weekly measures, which is just going to give you kind of a big, long history of as long as you've been entering forms into the PRAF. It'll show you kind of how many you're entering by form and the number of candidates and those sort of pieces of information. And you have this handy graph at the top, which you can scroll, shows sort of data back over, and it'll move the average around and the median around, kind of shift it up and down throughout as you adjust the graph. You can also see you have some sort of different measures you can select from the top here. So if we want to see the percent of candidates who accepted it, so it's going to show you again by week, 0% so far this week, because you can see down from the table down here below that there have been 0 candidates, so nobody available to accept it. And so this is the information that you kind of get here. And I'm going to click over to this usage tab, and you'll be able to see some additional information, and then I'll go into more how you can do filtering. So again, this is going to show some historical information, the number of completed forms by month, as opposed to week from the previous page. But let's just say that you wanted to see maybe how many progesterone prescriptions there were just for the month of November. So one of the things you can do is click this add filter button in the top right corner here. The first thing is going to be date range. So if I want to look by month, that's the best place to start. So if I go back here, I'm going to click the beginning of November, click the end of November, and then we're just going to hit this apply filters button on the left side here. May take a few seconds just as it refreshes the data. So you'll be able to see down here that there were 38 forms submitted total, and of those, one of them had a progesterone prescription associated with it. The form info tab is another tab where you can see where it's going to get some additional information. So again, this will just be related to November because you can still see this filter is applied at the top, to go down and be able to see this information for progesterone candidates, progesterone prescriptions, the weeks that when those were, the individuals were within those forms. But let's just say you wanted to be able to look more beyond just the date. You can add as many of these filters as you want on top of each other here. So if I click in here and I want to say, well, I just want to see the November ones related to a particular managed care plan. So let's see if I hit Paramount there and then hit apply filter. You can see that out of those 38, 3 of them related to Paramount. So this may be just helpful wondering what your kind of distribution is among the different care plans. And again, this doesn't have to do it. You can do it globally, and that's what it's going to default to every time you do it. Or let's say I want to get rid of that date feature and I want to see historically over the course of this particular practice how many forms have been Paramount or that Paramount, and you can see that now that number is 75. The other ones you can do, home health agency, again, just going to give you kind of these drop-down options that are from the form there. County, so you'll be able to look by any of the 88 counties, as well as we do have an option within the form to be able to enter folks, maybe if there's a folks outside of the state of Ohio, that will also appear as an option. OPQC, that's just going to give you a yes/no option. So basically, we have the form field that says, is this sort of OPQC related? If you hit yes, you're going to get all those forms there and then no, it's going to be all the forms where that no is marked there. And then progesterone candidate, and that's just being able to filter by that question within the form that will ask, is this patient a candidate for progesterone? Anybody who hits yes there, you'll have this drop down and hit yes, and that will allow you to apply that filter and filter that way. You can explore these other tabs. I'm not going to click through all of them and scroll through all the data pieces, but basically you'll be able to see the different information. The affiliations tab is going to give you breakdowns by the managed care plans. If you want to look specifically kind of globally, you'll be able to see that information as opposed to maybe applying a specific managed care plan within it. That's really all I had to share, and I wanted to sort of make sure I have some time to answer any questions that anybody may have, or anything else that any other presenters may want to share.
Thank you, Sean. Are there any questions for Sean? Again, you can put in the chat box if you're unable to get off mute, or if you could let us know that you'd like to chat, and we will get you off. If any questions arise, don't hesitate again to continue to use the chat box, or if it's after the call, we'll give you contact information so you can reach out. We can go ahead and go on then to the next screen. One more, next slide. Over the last month since the last call and in the questions that we asked you, there were a few frequently asked questions, and one of them was, how do I bill or get reimbursed? So I thought I really wanted to show you not only I will explain to you how you can bill and get reimbursed, but I also wanted to show you where you could find this information in case you forget and want to look back over it. So on the Ohio Medicaid's website, under the provider in the PRAF section, there is a multitude of information, more information about the PRAF than you ever, that you were afraid to ask. Now you can see the two circles. The bottom circle shows the ODM 10207 instructions. That form will, on the very last page, will show you how to bill and how to submit a bill for the PRAF 2.0. The other circle is a process map that I'm going to show you in a minute, but I wanted to show you where you could find it while we were on this page. Next screen.
So that does not sound like a short-term. So Michael, only he can answer that, and we'll have to take him at his word, whatever he says today at 2 o'clock. But
Pardon?
Kathy, I think, this is Mary, I think somebody was not muted and having a separate conversation. So go on.
Thank you. Next screen. So on page 3 of that 10207 instructions guide, the very bottom will list how to submit a bill for reimbursement. The bill is completed on the CMS 1500 837P form. Now, if you are from CareSource, Molina, Paramount Advantage, or if your patient is from United Healthcare Community Plan or the Medicaid fee-for-service member, you use the HCPCS code H100 when billing. If you are on the Buckeye Health member, then you're going to use the CPT code 59899 with a qualifier U1 for first trimester, U2 for second trimester, U3 for third trimester. Each of the plans reimburse differently for completions of the PRAF 2.0, and they each reimburse differently for different submissions. So typically the very first submission, they want to get it as soon as possible. So you'll get the highest reimbursement for submitting a PRAF 2.0 in the first trimester, early in the pregnancy. And then the reimbursement will go down from there. You can submit a PRAF 2.0, like I mentioned, at each trimester, and also at any time that there's a change in the patient's medical condition. Are there any questions about that? Don't forget you can use the chat box if you'd like to ask a question and aren't able to vocalize it. Next screen. And then, as I mentioned, I wanted to show you this PRAF process map. This walks through, this is on the Ohio Department of Medicaid's website, and it will walk you through pretty much step by step how to use the PRAF 2.0. Sometimes what happens is you might get started and then you're using it for a while and maybe the person who's doing it leaves, or you forget how to get through that MITS login. So this would be a good place that you could go back to refresh your memory. The first row is the setup, how to get on the MITS and how to get on Nurture Ohio, and then entering the patient information in the PRAF, submitting the PRAF, and then finally submitting a prescription on the PRAF system. Next, I really would like to hear from you. Let me know how it's going and what we can help you with from here. Please enter in the chat, or if you can vocalize your questions or concerns, or if you would like to, please let us know and we'll unmute you. Maybe could we unmute everyone for a couple of minutes and see if they can ask questions? Okay, so we're going through and unmuting. Please don't be shy. Any questions, or just if you want to share the experiences that you've had so far.
Kathy, we do have a question in the chat box.
Okay.
Actually, a couple of questions are coming through. The first question we have here is, so how does the biller know that the form has been submitted?
Hi, Sanaja. That I see that came from you, and I think that is a process for your office. I'm not exactly sure how, because I believe, if I'm correct, you're a biller, and the office staff should be, if they submit a bill for it, if they submit those codes, then I would say that was your indication that they submitted a PRAF 2.0. Does that answer your question?
What if we're in the balcony, babe?
Again, I think
else. I see that Carla Welsh asked, she was asking of Angelina about the asthma, spoke about the asthma. Was that found from a claim? Angelina, can you answer that?
On a PRAF, but maybe in a claim. That does tend to happen where a provider may put, all their information on the PRAF, but don't necessarily list, asthma as one of them, and so we may see claims, or during our, when we're talking to them, we'll ask them, any health problems, high blood pressure, diabetes, kind of like a run through of common illnesses. And they're like, oh yeah, I do have an inhaler. Oh, do you have asthma? Oh yeah. And so it doesn't seem as it's important. Whereas, if it's on the PRAF, we would know it ahead of time. So I'm not sure if that's what she was alluding to when it was found on the claim, but that's kind of what I was explaining.
Okay, thank you. Carla, did that answer your question? If we can unmute you if you'd like to talk.
Kathy, it looks like Carla is continuing to ask questions in the chat box if you want to address those.
Okay, or Sanaja.
Yeah, actually there was two. So the question from Carla was, where does it go on the PRAF?
Okay. Sean, could you help us with that?
This is Angie again. I've seen providers put choose other, and then they'll free text something like that if they have certain needs. That's where you can become more specific. So the option would be other, I believe. I'm not looking at it right now, but I have seen it, and then you can free text those identified needs.
Thank you. That's correct. And then, do you want to read Sanaja's question?
Sure. It says, in our practice, the coordinator submits the form, but then the biller submits the claim. In the past, the coordinator would just fax over to the biller that the form was submitted. So now how does this work, and will it go electronically? And I see here that Alicia Brown had remarked on this and basically stated the claims and the PRAF are separate. Is there anything else that, Kathy, do you want to add to that?
I don't think so, except for that I think that might be something very specific to your organization, Sanaja, and I think that maybe we could talk about it and we could kind of brainstorm and think it through a little bit so that we can make sure we understand how it's working for you. Why don't we try to catch base off? I'll reach out to you after the call.
Can you guys hear me? Hello?
Yes.
Okay, I've been speaking, but I couldn't get through. Sorry,
I'm sorry.
So I just wanted to say that the claims and the PRAF they're two separate things. They're connected. This is actually something that came up earlier today. So the PRAF is what notifies us of all of the needs that pregnant woman may have. And though we would think because something is being submitted via claim or billing that it would directly communicate to us or the managed care plan to trigger that we need to take an action on that patient's health or change in their health. And at the current time, that is not the case. So any information that needs to be, that Medicaid or the managed care plan needs to be notified about that pregnant patient, change in medical history or assistance that they need, whether it's with their health or a social determinant such as housing, transportation, et cetera, we would request that information goes onto the PRAF. And as someone previously mentioned, you could select the other if it's not there and type it in. And that way, Medicaid and the managed care plan are notified about what that patient's needs are. As for billing, I would like to I can assist if you want to provide your information to us. We can have one of our ombudsmen speak with you about any questions or concerns you have about the billing portion.
Thank you. I don't see any other questions right now in the chat box. Can you go to the next screen? We will be sending you this slide deck, so you'll be able to quickly find resources as you need them, this top listed resource is the Medicaid's webpage. It really has everything on it that you need. I did pull out the Nurture Ohio's user manual for your convenience here. And then there's listed the progesterone_PIP at medicaid.ohio.gov email. That is for all issues with PRAF. You have a direct ear of Medicaid with that email. So it really is a pretty powerful email. If you have any questions, concerns, or if you like something, tell them that you like it so that when they make upgrades, they don't take it away. The Ohio Perinatal Quality Collaborative also has a lot of patient and provider resources on our opqc.net website. Next screen. This is a list of the information that Alicia went over earlier. If you're having trouble logging into the MITS, the phone number you can call at the provider call center and the information that you need. And again, that very powerful email, progesterone_PIP at medicaid.ohio.gov. Next screen. And here are contacts if you need any additional assistance. Do not hesitate to contact me personally, or you can contact OPQC at info@opqc.net. And again, here's that powerful email, progesterone_PIP at medicaid.ohio.gov. You have Medicaid's ear with that email. Contact us if needed, if with anything. Next screen. We will be having these webinars again in 2019. We have not announced the date yet, but we will be doing that shortly. And they will be very similar calls to this, the Getting Started call, and then the Next Steps call that's based on the needs of the people who were on the Getting Started call. Next screen. This webinar series has been at the with the help of all of the people on our screen here. Takes a village, and they've all been very instrumental in helping us provide this information to you. If you have any questions, I will stay on the call for a few more minutes and monitor the chat box. Or please feel free to contact me directly. And otherwise, you can take the next few minutes. We ended a few minutes early. Hope you have a great rest of your day. Thank you very much for attending the call.